Hello everyone, I am Dr Battu Chaithanya, Consultant Transplant and Interventional Pulmonologist, Apollo Health City, Hyderabad. Every year World Pneumonia Day is observed on November 12th. Its aim is to raise awareness about pneumonia and to help people combat this infectious disease. Pneumonia is the biggest infectious killer of the world. It kills among both adults and children. Every 13 seconds we lose an individual because of pneumonia. And surprisingly, it is the most preventable disease which with the simple measures we can prevent it. So what is pneumonia? Pneumonia is an infection of the lung caused by a variety of organisms. Once it enters the lung, it creates inflammation, fills the alveoli or air sacs and prevents breathing and worsens the breathing difficulty of a patient. So how does pneumonia occur? Pneumonia occurs because of many organisms like bacteria, viruses or fungi. Most common bacterial organism is pneumococcal pneumonia, and viruses like influenza, coronavirus and other viruses will lead to pneumonia. Fungal pneumonia usually occurs only in immunocompromised individuals. And how does this pneumonia spread? Pneumonia spreads through droplet infection. When a person with pneumonia is coughing or if the person sneezes, then an immunocompromised person, if he inhales that, it enters into their lung and it causes an inflammation and fills the lungs with lot of exudative material and causes solidification of the lung. So, who will be affected with pneumonia? So, what are the risk factors for developing pneumonia? Not every individual will get affected with pneumonia, but persons with very weak immune systems like kids less than 5 years of age or adults more than 65 years of age, or kids between 5 to 65 with immunocompromised conditions like diabetes, hypertension, smoking, alcoholism, any other structural underlying cardiac failure, kidney failure or structural lung diseases, all these will be prone for pneumonias. And kids who are low birth weight or with any genetic abnormalities are also at increased risk for pneumonias. And how does a patient with pneumonia present? So patient with pneumonia presents with flu-like symptoms like cold, cough, a fever, and apart from that, if the pneumonia is significant enough, he develops sputum which is yellow or reddish in color depending on the organism, and if it is not treated or not identified, it may lead to respiratory failure or a sepsis, an infection in the body, or a pus in the cavity outside the lung, or it may lead to respiratory failure requiring oxygen support and ventilator support. And how do you diagnose? So when the patient presents with pneumonia-like symptoms, it will be diagnosed with a chest X-ray, blood counts, which will identify whether it is a bacteria or a virus, and other important tests like a sputum test, sputum culture or multiplex PCR test or a throat swab. So all these will help us in diagnosing the pneumonia. And once it is diagnosed, how will we treat? At early stages, if it is a mild pneumonia, we will treat with simple oral antibiotics. If it is a severe pneumonia, we will admit the patients, treat with IV antibiotics along with supportive measures like oxygenation, ventilator support and ECMO if required depending on the severity. And how do you prevent pneumonia? Pneumonia is simply prevented by observing basic measures like masking and hand hygiene, and apart from that, vaccination. So there are different types of pneumonia vaccines which prevent deaths because of pneumonia. One is pneumococcal vaccine, a 13 or 23 valent, and flu shots. So people who are at risk factors should take these vaccines to prevent this deadly disease. So please spread awareness among general public regarding the pneumonia because it is a preventable disease. Stop pneumonia because every breath counts.